Gout is often diagnosed based on the particular pattern of signs and symptoms. So a person who has an attack of acute pain, swelling, redness, warmth of a individual joint, most commonly the big toe joint, but it can also be ankles or knees involved, may be diagnosed with gout based on, again, this pattern of signs and symptoms. However, ultimately, in people who have recurring attacks of suspected gout, the diagnosis ought to be confirmed by aspiration of fluid from an affected joint and examination of that fluid by a physician by polarized microscopy, which enables the physician to see the uric acid crystals within white blood cells. If this fails to confirm the diagnosis, we know that there are some patients in whom this can be negative, but a certain type of CT scan called dual energy CT can lead to confirmation of the diagnosis. The main treatment for gout is to reduce the level of uric acid in the body. We do this typically by administering medications known as xanthine oxidase inhibitors. These medications inhibit the production of uric acid and thereby decrease the concentration of uric acid in the bloodstream. Over a period of many months and sometimes years, the deposits of uric acid in the body and in and around the joints finally begin to resorb, and the uric acid burden in the body goes down. When we can achieve that, the frequency of gout attacks goes down, and ultimately we can completely abolish attacks of gout in the majority of patients with this treatment strategy. It does take time, and we have to be patient with these medications, but again, in most patients we can achieve the goal, which is to get the uric acid concentration to a specific level. The target is to achieve a uric acid concentration in the bloodstream of less than 6 milligrams per deciliter, and physicians use this as a gauge to know if the medications are working and if indeed we've actually achieved the goal of the treatment.